After 15 hours up in the air, coming from Sweden, a bit tired though, and on the airplane you got these landing cards to fill in, which we did. So, and we thought that's all. But then when I realized that there was a health check as well, and I was quite surprised because I traveled a lot in the tropics, and in the older days you always had to fill in this health declaration. It was a health check, but you don't see that anymore. At least not very much. But here I noticed it, and then I thought it was a normal health declaration. But then I realized that it has to do with the swine flu, and I was quite impressed when I got this little card telling about this disease and what to do and the symptoms. And also what's very important is that you get the telephone numbers of, I think it was 5 hospitals that you could contact, and that must be very useful for people, because I don't know where to go if I feel sick. So that's why I was quite impressed. Just 2 weeks after the outbreak of this flu, here in Trinidad you have this printed information to all arrivals. That's impressive. We got that general information in Sweden in the newspapers and in TV and so forth, how to handle this, but nothing on the airport.
Basically what we have is individualized health declaration forms, and these are given to the airline personnel and are expected to be completed by passengers prior to disembarkation at the airport. If they fail to receive this form, they can receive it after disembarkation, and they will be assisted by our health personnel in filling out these forms. Having filled out these forms, they proceed to one of 2 stations where we have our personnel, health control officers or public health inspectors, who will collect the form and basically go through the form. Having done that, they will then decide whether the passenger can proceed to immigration, or if we need to intervene by sending the passenger to Port Health to be reviewed by the medical officer on duty.
Now, what kind of questions are asked in the questionnaire?
Right, basically we ask their demographics, name, age, date of birth, and so on, but very importantly is the travel history of the passenger. Have they visited within the last 7 days a country where there are known cases of swine flu? And we also ask about certain respiratory tract symptoms, presence or absence of fever, contact with any individual known to have this H1N1 virus, things along these lines.
Are there any major red flag places that you would look at? Like, let's say they're coming from, I don't know, Mexico.
Right. Mexico would be...
They would automatically be pulled over and interviewed, right?
The next case was in Mexico, so we would be quite concerned about people having visited Mexico recently, and also certain areas of the states like Ohio, Texas, and recently Nova Scotia, Canada as well.